Hello, I'm Dr. Charles Duffy. I'm a professor of neurology at the University of Rochester and the inventor of the world's first FDA-cleared dementia test called Cognivue. Cognivue is a breakthrough medical device developed in response to the worldwide epidemic of late-life cognitive decline. With over $600 billion being spent every year on dementia care, it is clear we need more affordable and accessible solutions for the routine assessment of brain health. Cognivue was designed specifically for use in primary care to provide affordable access to cognitive care. Cognivue is the first of its kind computer-based solution developed to measure and monitor brain function and detect the early signs of dementia. The 10-minute Cognivue test is administered in the doctor's office and interpreted by the primary care practitioner, all of which is reimbursable to the doctor. Testing is automated and proceeds at the patient's own pace, under well-controlled conditions to improve test accuracy while minimizing effort and stress. Physically, Cognivue is a self-contained mobile platform incorporating a computer, keyboard, and privacy screen with a specialized patient response device called the Cognivue. Compared to a traditional mouse, the Cognivue limits the patient's required responses to simply turning the wheel 360 degrees, simplifying testing and minimizing test variability. Cognivue's test battery consists of 10 one-minute tests. The tests measure your movement, vision, and the perception and memory of letters, words, shapes, and motion. To start a test, the operator enters the patient's name and age using the keyboard. Cognivue automatically adjusts the speed and brightness of testing to match the speed and vision of each patient. To ensure the patient understands each test, several practice examples are provided at the beginning of each test. In all 10 tests, Cognivue records the ability of the patient to respond to the movement of an on-screen target or to visual tasks using the Cognivue. When testing is complete, the tests are scored in real time and compiled in a secure data record for physician review and storage for long-term reference. Cognivue immediately creates a one-page, easy-to-interpret report combining scores and graphs to aid in the interpretation of the tests and discussions between the patient and the practitioner. The top left quadrant provides the text fields of patient identifying information and other relevant information. Directly below is the average test score, plus an aid to understanding the test score. Higher scores reflect better performance. Average scores at or above 75 suggest that the patient is doing well and is not impaired. Average scores at or below 50 suggest the patient may be having some trouble that should be discussed with the patient. Scores between 50 and 75 may indicate that the patient's brain health is under stress and that the doctor and patient should discuss it. Scores for each test are presented in the bar graph with tall bars representing better performance. Accuracy during each test is shown as the series of line graphs along the bottom of the report. A high level on the line graphs indicate good performance. The doctor will combine test scores with everything else about the patient's medical condition. Together, it will create a composite picture of overall brain health. The test report can be sent to a printer and stored as a secure file for local or cloud-based retrieval at a later date. To summarize the benefits of using Cognivue, it is the first FDA-cleared dementia test designed for primary care providers. Easy to do, simple to understand. 10 tests in 10 minutes. Private and self-administered. Reimbursable to doctors, producing a one-page, easy-to-interpret report with one quantitative score of brain health, leading to permanent storage for later comparison. All records are kept strictly confidential.